Well, did you know it is Autism Awareness Month, and we are honored to be joined by Dr. Katherine Burns of HCA Midwest to talk about Autism Awareness Month. Thanks so much for being here, Dr. Burns. So let's get into it. What are some of the big themes and bullet points that you want people to be thinking and talking about during Autism Awareness Month?
First of all, that autism is really autism spectrum disorder, meaning there are a variety of levels of symptoms and needs with people with this disorder.
Yeah, I feel like in the last 20 years or so, we as a culture have all had sort of a education on all the nuance to this, that there's a spectrum, obviously, that it's not just one or the other. And one point that I wanted to ask you about was like the difference between Asperger's and autism. What's the key differences there?
So about 10 years ago, when the big psychological organization that puts out diagnostic criteria rewrote their book that we call DSM-5,
yeah.
Multiple disorders such as autism, Asperger's disorder, and a couple of others that are not as common were grouped together now under autism spectrum disorder. So Asperger's disorder kind of went away, and a lot of people with Asperger's were not thrilled with this. But one of the reasons behind it is that not only is there a spectrum of symptoms, there's a spectrum of needs in those. And so even though a person with Asperger's disorder who may be highly verbal and highly intelligent, they may not be able to function without support as well as they should be able to.
Right, yeah. And you mentioned the DSM-5 there, like I do. Am I correct? I feel like I've read there was a time when people said, why are there suddenly so many new autism diagnoses? What's happening? And it's not so much that there were more of them, but there was just better awareness and sort of a change in the way they classified it, correct?
Generally, yes. There probably has been somewhat of an increase, but the data is a little muddy on that. There are also people who we would have called intellectual disability only 50 years ago that we realize have also meet criteria for autism spectrum disorder and may benefit for some of the therapies that we have available.
Gotcha. So again, it is Autism Awareness Month. So if you're a parent of little ones, you know, it's a big issue. What are some signs? What should you look for?
So people think of my child isn't talking as the first sign. And while that certainly can be appropriate, there are other reasons for not talking well. The two most specific signs that go with autism spectrum disorder are difficulties with eye contact. So a little child that doesn't have words, if they want their cup, they will either point to it or look at you, look at the cup, and look back. And then the other is absence of a point. If a child can pick up food like this, that's the same skill as being able to point.
Interesting. Wow, God, I wish we had more time. Dr. Burns, where can people go if they want to learn more for Autism Awareness Month?
So Autism Speaks is a national organization. They have a website with fabulous information. And then if you have concerns as a parent, you go to your pediatrician or family care physician.
Awesome. Dr. Katherine Burns, HCA Midwest, thanks so much for coming in.
Thank you.